She took her exam just a few months ago and did not pass. So she sought tutoring services, and she wasn't quite feeling it with her tutor. Then we met, and I assessed her. I learned that she had some learning disabilities, at least diagnosis, that she had a busy lifestyle, and she had a desire to pass her exam. She knew she could pass. She wanted to be a nurse. And so we worked together. I think we had like 2 or 3 visits, and she was saving her last visit for when it was closer to her exam. She had a wedding to go to, came back, studying, used some of the tips I had her, color coding her drug cards, etc. And then she messaged me. It was like less than 2 weeks before her exam. And she was like, Timika, I took my readiness assessment and it said that I had, that she would not pass, a very low score in passing. And I said, that's not right. I didn't believe that was right in my heart. So we talked and I said, what was going on while you were taking your test? And what were your thoughts? And she said, I was just saying that I wasn't going to pass and this is hard. And that she had already not passed. She was living in the past. That's how she was talking to herself. And as she was sharing this with me, light bulbs went on, because then she realized what she was actually saying to herself. And so I said, hey, take a walk in nature. I want you to relax, take a walk in nature, clear your mind. And I want you to write down right now, I will trust myself. And I want you to put that right in front of your computer. And she, as I was talking, she was writing it down. And so I was like, kind of asked, I was like, I wonder how she did. And she messaged me and she said, the message had that not only did she pass her readiness assessment, but she had a very high chance of passing. And that sounded more like her. And she was so excited when we met the final time. And then I got a text message a few days later saying that she had passed. And of course, I call all my clients who took their exam, and I call them, I talk to them and say, well, how did it go? What happened? And she said, Timika, all I did was focus on the keywords. I was in that treasure hunt. And so I tell you this as a Monday affirmation, motivation, that do not let a previous not pass on your NCLEX deter you. Do not let a medical diagnosis or a learning disability or a mental health diagnosis deter you. You have what it takes to pass your exam. And as I often said, change your belief, change your affirmations, your self-talk, assess that and see what you're saying to yourself. And because that power underneath that affirmation, if you're using a positive, negative one or negative words you're saying to yourself, and then you say, when you don't pass, you say, I knew it. I knew I wasn't going to pass. Did you really know it? Or did you think yourself into not passing? So again, Monday, let's change those thoughts. Let's change our approach. Let's change how we see the NCLEX. Let's change how you see yourself and see yourself as a nurse. All right, I'll talk to you guys soon. Take care of yourself. You have what it takes.